Hello and welcome to Meet the Experts, your show to hear from experts about everything beauty, health, and wellness. Today's topic is on how to address sagging and aging skin with Pdo Threads and discovering the newest FDA-approved filler that is available now in the US called RHA. So if you are seeing sagging skin when you look in the mirror and you are wondering what can you do to look more youthful without plastic surgery, you are definitely in the right place. Today my guest is Dr. Lisa Vuich, who is an expert in medical aesthetics and regenerative medicine, and she is here today to share with you the latest in regards to these two very, very popular treatments, which are again Pdo Threads and Fillers. A little bit about Dr. Vuich. She is a speaker, an author, an educator, and founder of Renew MediSpa and Training Institute in Dori, New Hampshire. Dr. Vuich is here today to share with us the most popular treatments to combat aging and sagging skin so you can regain your youthful appearance. So stay with us and discover what you need to know about Pdo Threads and Fillers. Welcome, Dr. Vuich. Thank you so much for taking the time to be with us today. I am so excited to have you on the show.
Thank you for having me, Dori. It's a pleasure to be here.
Oh, I'm so excited about our conversation today because I think consumers definitely are looking for this kind of information. So can we start by telling our audience how and why you made the shift first from traditional practice to actually having your amazing, beautiful location of your MediSpa and medical aesthetic and your training institute?
Sure, Dori. I finished my chief residency back in 1996, and from then until actually 2009, I worked in internal medicine. I was basically your primary care physician. You know, in one way or another, I was originally part of group practices and then had a private practice from 2003 to 2009. At 2009, I sold my internal medicine practice to a hospital, as you know, was fairly common at that time, and was working for them half-time and doing medical spa treatments half-time as well for a few years. And then ultimately in 2012, I went 100% medical spa. So for me, the decision really had a lot to do with where I felt the most gratification, where I felt that I was making the greatest impact. Certainly there was a piece of me that was very frustrated with what was going on in medicine at the time, you know, where physicians were, you know, overworked and underappreciated, and there was a lot of game playing, a lot of dissatisfaction at the time, you know, in terms of just really just soul gratification, just loving what you do. And I just felt more and more drawn to aesthetics, to the art of aesthetics, and ultimately that was my exit, and I developed a full-time medical spa and then a medical spa training institute. So I really just took the aesthetic piece, grew it, and also we do a lot of treatment for men and women for sexual dysfunction. So that piece of it, the hormone balance and treating sexual dysfunction, has really kept the internal medicine piece for me, if you will, within the medical spa. And then there's the whole other aesthetic piece, which is facial and body beautification. Yes. So that's, you know, certainly stands out on its own. So I sort of feel like I've merged both an internal medicine, sexual wellness practice with an aesthetic beautification practice, if you will.
Yes. Yes, as a matter of fact, I've had the pleasure to come to your location. It's absolutely beautiful. It's probably one of the most beautiful medical spas I have seen. And I want to congratulate you first on having such a great vision and making it a reality. And I know that your MediSpa offers a full menu of anti-aging treatments and, like you mentioned, also sexual health. But for the purpose of our conversation today, you know, we are focusing on the two treatments that you do so well and that you teach others actually to also do. So let's start there. Let's start by talking about Pdo Threads and Fillers. Maybe just an overview first, and then we can dive into each one in particular.
Sure. Well, most people who've done any sort of aesthetic treatment are at least somewhat familiar with fillers. Fillers restore lost volume, and volume loss is certainly a part of facial aging. But there is a point where you've restored what's lost in terms of volume. In other words, you've put back the volume that's been lost, and yet someone is still in the mirror going like,
that's me.
Right. So here's the thing. If you try to lift too much with filler, you very quickly can cross over into the crazy cheeks, the cheeks that are out of proportion, the cheeks that look alien, the aesthetic eye, even just the average person in the community, regardless of whether they're into aesthetics or not, their brain and their eye tells them when something's not right, when it's out of proportion, when it isn't natural looking. So if you try to lift too much with volume, you will get into unnatural proportions, and the eye will know that. Someone will look at your face and know something's not right. It's not correct. It's not aesthetically appealing. So if someone has normal volume, or they've restored a normal volume and then they're still looking for more lift, that's where Pdo threads really shine, because they can give you a repositioning of the volume in a more aesthetic, more youthful appearance without plumping more. So when you want to lift but not plump anymore, that's your threads.
All right, so that was a great overview explanation, by the way. Thank you so much. So let's talk a little bit about the threads themselves. Like when somebody hears threads, can you describe to them what the treatment is really like? Are you literally putting threads in my skin and you're pulling things? Can we give them a little more of an explanation?
Sure. There are two main types of threads. There are lifting threads and there are smoothing threads. Now, smoothing threads are very fine, very thin, short, tiny little threads. They're like the thickness of a hair. Those can be placed in a mesh-like fashion into the dermis, into the deeper layer of skin. And for the life of those smoothing threads, which is about 3 months, they will stimulate collagen as simply a foreign body reaction. So your skin cells will react to smoothing threads by dissolving them and creating new collagen in the act of dissolving them. So that's called smoothing threads. Lifting threads are much thicker, longer threads. Now these I would call them more sutures, if you will, and they are mostly made out of PDO or polydioxanone. That's the same suture material that's used in the operating room to sew up skin and organs and such. PDO lifting threads are really gripping threads that have the ability to reposition soft tissue, actually lift tissue on the face, primarily the face. They're much less useful on the body, although they've been tried there as well, but they're meant to elevate the volume you have. Those threads go into the fat of the face, so they're going just beneath the skin through nothing more than a needle poke, and because of their design, they're able to reposition that soft tissue and give it a few millimeters of lift.
That is so fascinating. Now, I know PDO threads started in Europe originally. Please correct me if I'm wrong. And then they started becoming more and more popular here. And now we're hearing of them being used in other parts of the body as well, like you just mentioned. So where else are you seeing this is becoming a popular procedure besides the face?
Well, technically threads have been in use really since the 1980s. It's only in the U.S., I would say, since about 2012, 2013 in there that they even started to catch on. Back in 2015, when I trained on threads, I had to go to London to train because there really wasn't any training in the U.S. for threads. I will say that in my experience, the greatest utility for the lifting threads is on the face. On the neck, less so, although I've gotten some decent results on the neck. There are many places that will try threads on the body. And I will say, in all honesty, I feel that there's much less utility there. The threads are much more easily displaced with just natural movements of the body. So I see a lot more limitation for body threads. I'm not saying it's not done in some places, but if you think you're really going to get a leg lift, a butt lift or a breast lift with PDO threads, I would say in the most case, you're going to be disappointed. It's just not the best utilization of the technology. Face is the number one utilization, and neck secondary, although there are limitations there as well.
Well, that's why I wanted to invite you on this show, because of your honesty and your expertise. And, you know, some people just want to sell treatment to sell treatments. So that is such great advice you just shared with everybody. And I have seen some of your before and after pictures for thread lifts on the face, and it is truly amazing that you can delay plastic surgery now by how many years do you think you can delay that process?
Yeah, probably 5 anyway. You know, we certainly, the vast majority of people who come to me for threads actually are not interested in a surgical approach, period, ever. They've just made the decision that that they're drawing the line in the sand, that they want to do everything but go under general anesthesia for a surgical procedure. So for me, I see it as more an option instead of. However, having said that, if you do threads and then you ultimately opt for surgery, I mean, you're only adding collagen to the soft tissue.
Right.
You know, that will ultimately be operated on. So if anything, it gives the surgeon better quality tissue to work with, tissue that has more robust collagen content, healthier skin, healthier soft tissue. So it certainly doesn't get in the way of a surgeon if that's ultimately the way you want to go.
Great advice. Now, as far as the threads themselves, are there different brands, and does it matter like what my professional is actually using on me? Should the consumer be aware of certain threads over other ones?
It does to some extent. I mean, there are definitely brands that have, we call them molded barbs. So that's where a thread has grabbers or catchers on the thread that are thicker and really sort of added on to the substance of the thread itself, as opposed to threads where they just cut into the thread to create a sharp point, which is called a cut thread versus a molded barb thread. So molded barb threads, and you'll be able to find this online, there'll be pictures of this. Molded barb threads are stronger. They'll give a greater pull, and they're thicker, so they will last longer. Cut threads are cheaper threads. They will not lift as much, and they will not last as long. Now, having said that, to me, this is a little bit also like the discussion of, is there a best filler? To which I always answer, well, there are some that have advantages over others, but maybe at the end of the day, you should worry more about who's holding the syringe than what's in the syringe, right? So the technical skill of the person performing the threads is just as important, if not more important, than the thread composition.
Absolutely. So well said, actually. And that brings me actually to would somebody choose who they should go to actually have their threads done?
Again, we get back to sort of the basics of how do you pick an artist, right? How do you select an aesthetic provider? It's a difficult decision. You have to often, you don't always have the luxury of having a friend or family member who've gone to someone. So I think you do have to rely fairly heavily on their credentials, their before and after photos, what connection you feel you're able to establish with the office. You know, really, you know, and again, maybe looking at those molded barb threads, knowing that those brands are you know, going to be a little bit more of an elite brand, and the providers who use them might have more experience because they're technically more difficult to place. So it is, I will admit, it is difficult, but it's difficult to pick a filler injector, right? Isn't it?
True.
Or a Botox injector. I mean, how do you choose? I mean, ultimately you have to go on reviews and experience. How long have they been providing a given service? What are they able to show you for before and after photos? and what does your gut tell you about your interaction with that particular practice?
Yeah, you have to feel good about the place and putting your trust in someone, and that's definitely important. So doing their homework would be good. So how painful is that, Dr. Vuich? Like the thread treatment itself?
The most uncomfortable portion of the treatment is really the numbing, which is similar to the numbing that we perform for dermal filler injections. It's a little bit more lidocaine than typical, but it feels like a pinch and sting as we're doing the lidocaine along the tracks of the thread. After that, the thread positioning itself is actually not uncomfortable at all. So for most people, it's really that first 15 minutes of getting the treatment area numb. That's uncomfortable, but it's not anything that requires sedation or heavy medication or anything like that. It's really not that much different than a filler injection at the end of the day, just a little bit more lidocaine.
Nice. So what would be the healing process like? How long would it take for somebody to really be able to heal and see the results?
The nice thing about threads is that you do immediately get an instant lift. Now, you have some initial swelling, and that usually lasts from 1 to 3 days. Again, depending on, we're talking about lifting threads now, depending on how many have been placed. 2 or 3 days of puffiness. It's mostly something that's most noticeable to you and not so much to the average person, passing you in a supermarket sort of thing. They wouldn't know the difference. But noticeable to you, I would say puffiness for a few days.
Now,
There's about 2 weeks of discomfort in terms of, feeling a little bit of soreness when you touch along a track, or perhaps if you move your face suddenly, you might feel a pinch or a sting. So there's a little bit more downtime than with the typical Botox or filler injection, for sure. And there's a period of activity restriction where you can't do heavy exercise for 3 weeks.
Right. Well, I'm sure some people would be happy about that. Like, I can skip my workout. I just had threads.
Absolutely.
So how long will the results last? Like, let's say I had my threads and had several in my face. What's the expectancy of the results?
Again, I have to say, going back to similar to dermal filler, how long the result lasts depends in part on how much you do at the beginning. So if I do a full thread lift on someone, meaning I'm doing a full set of threads, I'm going for the maximum lift I can get, I want the most correction in a single session, I'm really going for the gusto, I tell that person, well, maybe in a year we'll look at it and we'll touch something up. Maybe we'll add a few to the cheek or add a few to the jowl, or at that point you're in a maintenance mode, and you might just add threads once a year. On the other hand, we have people who aren't as comfortable in the beginning with doing that, let's quote unquote, bigger procedure. They want to start small. So if someone starts with, let's say, just a cheek lift with threads, that, maybe we do 3 or 4 or 5 threads and we're really just going for that pickup in the cheek. Well, they might be looking to add to that in another 6 or 8 months. They're not going to go a full year because they didn't do as much in the beginning, right? So you can start slow and do it more frequently, or you can start big and do it less frequently. And that's pretty much the same rationale, the same advice we give for fillers. You can either correct it all at once and have an easy maintenance, or you can correct it in stages and do it more often until you can get to a maintenance phase.
So when the threads dissolve and they're building that collagen, so when you go back to redo the treatment again, let's say a year down the road or 6 months, so do the threads totally disappear? Do they actually totally dissolve? And you're just re-implementing more threads in the face? How does that work exactly?
Correct. I mean, any thread material that has dissolved has left collagen in its place. So it's not a problem to go back in and put more threads in the same area, because we're not dealing with scar tissue. We're just dealing with skin that has more collagen in it and subcutaneous tissue that has more collagen in it. So we always say the collagen outlasts the threads. So although the thread material is dissolving, the more you do threads, the longer ultimately you'll go in between visits, because the threads will dissolve, but the collagen will left behind, and then you're riding that collagen, and then you're riding that collagen, and you're riding that collagen. So ultimately, you can go even a year and a half or 2 years in between thread appointments if it's something you've been doing for a while. And that's something that can be said, true for filler as well. If you've been doing it for a while, you can go longer and longer because you're really building on a base.
Yes. Now, I know that you've been doing this for a while, and you're teaching now other medical professionals to actually do PDO threads. So if anybody who's living in New Hampshire or even anywhere else, you're looking to have your threads done, you definitely need to check out all the different treatments and methods that actually Dr. Vuich teaches others on how to actually do that treatment, because it is truly artistry, right? At the end of the day, it's all about where you're placing them and the techniques and the precision in which you need to place the threads for the best results. So what drove you to actually start teaching others how to do that treatment?
Well, as you mentioned, this is truly an art form, and I think that's really where I get a lot of my gratification in aesthetics, is using my artistic eye and customizing a treatment to a specific face. So that's a lot different than just, plopping 20 units of Botox somewhere, right? Which is not as artistically appealing. But if you can take a face which has, normal muscle action and normal volume, and then, elevate the tissue and create entirely new shape and form and a more youthful contour, that to me is very gratifying, very exciting. Patients are very excited, by that, by what they can accomplish. That's really just occurring through needle pokes that are no bigger than, an IV poke. And to me, that's the beauty of threads, is what can be achieved in terms of a result through nothing more than a needle stick. And that's exciting to me, really being able to achieve almost surgical correction, albeit temporary, but almost surgical correction without surgery is very exciting.
Absolutely. I mean, anytime you can delay or, like you said, totally not do plastic surgery, and you can do a non-invasive treatment like that, I'm almost ready for that, by the way. I need to come and see you. Let's talk.
I have 30-year-olds coming to me saying, should I get a facelift? And I'm like, sweetheart, you've got 30 years to go before a facelift.
That's
what
crazy.
Are we gonna do? Like, really? Because how many times are you going to do a facelift? Like, really? Once, maybe. So let's not jump to the knife. If we have things that can help you feel better and more youthful, and sort of delay that. I'm not saying it's off the table necessarily for anyone, but it's not something, because of the scar tissue that forms with surgery. I mean, even surgeons don't want to go back and redo facelifts. Let's be honest. They don't want to do it. They don't want to do it. So if you're going to go for a facelift, do it as your end of the line. Like, this is it. I've exhausted other options. That's how I feel about it.
And what I love about PDO threads actually is that even if they already had a plastic surgery and they don't want to have another one, then let's keep up the maintenance with doing threads. Have you been seeing that?
Oh, absolutely. I have a lot actually of patients who come to me and they're like, well, I've already had a facelift, and I don't want to do that again. What can I do? And technically it makes it different. It's slightly more challenging. I mean, I definitely feel that if you've had a facelift and you're going to have threads, you definitely want to go to someone who's more experienced with the threads and with the vectors. And, you're not someone who should go to a beginner. But it's just a matter of working through, a little bit of scar tissue. It's not a big deal. In fact, to be honest, that scar tissue gives the threads even a little more purchase, a little more something to grip into sometimes, so it can actually work to your advantage.
Nice.
But it is a whole nother population of clients we're seeing who have had a facelift already, and they're looking for improvement and looking for something non-surgical this time around.
Absolutely. And you know what I love about it too? When you go get a plastic surgery, you're talking thousands and thousands of dollars, could be 20, 30,000, where they go get PDO threads. you're talking a fraction of that investment, right? So it makes a big difference. Let's talk a little bit about combining modalities, like when you want to talk about the FDA approved also filler. So how do you decide when you combine, or when should you just do fillers? Or let's talk a little bit first actually about the newly FDA approved filler, and then maybe you can go into combining modalities.
So one of the fillers we've brought in recently at Renew is called RHA, or the RHA Collection. So the RHA Collection is a collection of hyaluronic acid fillers, and those are the most popular fillers, in any country, including the U.S. But what the RHA Collection has at its advantage is their manufacturing process is the most sophisticated. So by that I mean all of the hyaluronic acid fillers on the market, including your Juvederms, your Restylans, your RHA, your Bellatero, etc., they all have hyaluronic acid as their, let's call it, active ingredient, okay? What differs really is the manufacturing process and how they stabilize the hyaluronic acid so that it doesn't just dissolve away the way a sugar would. And that's really what sets different filler brands apart. So the RHA Collection has been able to stabilize their hyaluronic acid without a high degree of chemical modification. The good news about that is that your body is not going to be as likely to recognize that filler as a foreign body. So we've gotten lots of questions recently about fillers and reaction to COVID vaccine and fillers and delayed swelling, etc. And again, a lot of that has to do with immune reaction or immunogenicity of fillers, which relates directly back to how chemically modified are they? How foreign do they look to your body's immune cells? So the RHA class, because it is not highly chemically modified, because the chemical bonds, if you will, are very natural looking to the body, they are the least likely to incite an autoimmune response. So we're expecting that type of filler is going to be much less likely to cause an interaction with, say, a vaccine-induced, immune event, like a COVID vaccine, for example. So we're very excited about being able to showcase and offer a newer technology in fillers. They also move very naturally. They flex very naturally when the face moves. Those subtle things, from one filler to another in terms of flexibility that can make one look more stiff and one move more naturally, can make all the difference, to someone if they're looking at their face after a filler injection in terms of whether they're satisfied or happy with their result.
Very nice. That was very insightful. Thank you so much for sharing that. So when you're doing fillers on someone, where do you find you get the most noticeable change based on where you inject in the face? When you're doing, of course, the lips, the cheeks, is there any place else that you're actually putting fillers in now?
There are a number of obvious areas. You mentioned a couple of them, the lips. Mid-face volume or loss of cheek volume is huge. Most people who have facial aging will start with volume loss in the mid-face, and that makes a big difference in terms of youthfulness, appearance of the face. So one of the first areas we go to in mid-face, augmentation, one of the first things we do is filler. Now, in terms of the order of, what do you do first? I usually will go first to volume and later to repositioning. And that's generally how I present that. And the analogy I use is imagine, the bedspread and a sheet, right? So, if the bedspread has chunks of volume, stuffing pulled out of it, right? And you tighten or lift the sheet, it's still not going to look great, right? Because you've got craters of volume loss that you haven't fixed. So you can tug on that sheet, you can lift that sheet all you want, but if you haven't corrected the volume loss, if you haven't put the stuffing back in the mattress, it's not going to look so great. Now, flipping that around, if you restore lost volume and your mattress is nice and smooth, but your sheet's all crumpled up and it's got brown spots all over it and it's falling off, that's not going to look aesthetically appealing either, right?
No.
So this is where we really get into a discussion of combination therapy. How do you combine just naturally restoring lost volume and then also addressing that top layer, the sheet, making sure that's smooth and tight. And then if the mattress is sinking, if it's like caving in, right, if it's dropping, you have to lift it up. You have to do something to re-elevate the cushion, right? So if you look at facial restoration, I think with that in mind, we want to smooth the surface, address the sheet, address loss of volume in the mattress, and if the mattress is sagging, pick it up. And that's basically what we're doing with facial aesthetic restoration.
Well, I love what you're talking about, because really if you combine, if you have your Botox, your fillers, and your threads, you just rejuvenated yourself in a major way for really a minimal amount of downtime. There's like hardly any downtime. And for a much better investment than having a plastic surgery, you just really reconfigured how youthful you can look by these treatments. It's just amazing that in today's world, we can totally look much younger in a very simple, I mean, I know it takes a lot of expertise to do the treatments, but to a consumer, it's like, oh my gosh, I can go into Renew Medispa looking saggy and old and walk out looking absolutely beautiful. I love it.
The one other main piece there, Dori, would be laser resurfacing, because there really is a place for energy-based treatments as well in terms of removing sun damage.
True.
In a way that can't be addressed adequately with filler, Botox, or even threads. So I do want to put a plug in there for energy-based treatments, because again, if someone tries to chase fine lines too much, with filler, for example, you very quickly, again, create abnormal contours.
Right.
Or if you think that smoothing threads are going to be the answer for all fine lines, that's not going to be the case too. So I'd put that in as a fourth item to consider. Yes, wrinkle relaxers, Pdo threads for non-surgical lifting, filler for volume replacement, and laser resurfacing, even as just an initial treatment to pull out brown spots and to resurface fine lines. Those are going to be your four main anti-aging therapies.
That's great advice. Great advice. People are going to love this. So let's talk a little bit about your institute. You teaching other medical professionals how to do these treatments, and your passion to really improve the industry as a whole and make sure that everybody's doing a great job, and that way consumers are rushing not only to your medical spa, but truly you want to make an impact as a whole for everyone. So I love that you're actually taking that path and creating that institute. And by the way, if you're watching this and you are a professional, you have got to check it out, because it's an amazing facility. And obviously you can tell she's amazing at what she does. So tell us a little bit about what kind of programs are you offering now in the institute, and how are you really helping other medical professionals be able to really level up their expertise?
Well, it's interesting, Dori. I mean, prior to last year, the vast majority of the trainings that I was doing as an aesthetic provider were private and semi-private experiences. So a lot of times, nurses or physicians would come to me after they had already been to often multiple small group and large group trainings, and they'd be coming to me for more advanced level injectable training, whatever it may be, or thread lift training. Because what would happen in the large group trainings is that they would get a decent didactic background, but then when it came to the actual hands-on experience, they'd maybe work on a half a face for 20 minutes, and that would be the end of that. And no one feels comfortable or confident with a new technique with that little hands-on experience. So I would often be like the next level training. So the concept when we expanded into Dori and opened the separate MediSpa Training Institute was we were going to offer small group trainings which were heavy on the hands-on, but still provided all of the didactic. And that's pretty much worked out, except then COVID intervened, and very little was happening in terms of group instruction, and a lot of different people started doing online training experiences, and there's good and bad and in the middle out there as well. But I think at the end of the day, what I feel like our niche is really intensive, hands-on oriented trainings for providers who are in a position where they need to get really good really fast. For whatever reason, because they're in a time crunch and they want to launch something and they don't have 3 years to spend in 20 training classes. They need the best, most economic, I don't want to say short, but I want to say focused, intensive, private, semi-private training on high-end advanced techniques. And I feel like right now, that's really where my training institute is sort of living, is in more of a concierge, more of I'm less about, I'm doing a Botox training on June 30th. I have room for 10 people, right? Okay, you can find that anywhere. I'm more about, you want to learn how to do Botox? All right, first you're going to take my online 3-hour course and you're going to pass a test. And then you're going to book a date with me and I'm going to line up 15 faces for you to inject with me watching you every step of the way. Find that.
That's amazing.
That's what I feel. And that's more exciting to me too, is really, not to stand up in front of a room and blah, blah, blah about how Botox works, but really to deliver the artistry and the facial analysis and the decision making that goes along with an intensive hands-on day that's been created for a provider. So I feel like, that's what I've learned from COVID, is focus less on groups and more on what you loved in the very beginning, which was customizable, intensive hands-on, that was, sort of private or semi-private. So I'm rolling with it.
I think that's a great idea. And what I love about it, actually, when somebody comes in and you're lining up all these consumers to inject them, you're bringing their confidence level up too. So they're learning and they're feeling more confident and more skilled, so they can go back and do right by their consumers. Because the last thing we want is for somebody, to have a bad experience, that's for sure. As a matter of fact, I know that you guys, you and your team, are so good at what you do, and I've had the pleasure to see it firsthand. And you have people driving and flying from all over the place to come and see you. I really want to encourage everybody to definitely go to renewmedispa.com and check it out, because you have some amazing treatments and modalities and different options for people. What is the best way for someone to reach out to you? What's the process? What can they do?
Well, certainly, through our website, renewmedispa.com is always a good start. We do monitor communications and messages through that, of course, constantly. You can also reach me directly at lisa@renewmedispa.com if you are interested in training or want more information about any of the procedures, and we can go from there as well.
That's great. Any last-minute advice to the audience as far as how to maintain a great image and a beautiful appearance?
Well, sun damage, people.
Yes.
It's it's a what am I going to say? It's job security for me.
Yeah.
But sun protection is huge. I mean, we spend a good part of our days in the MediSpa undoing the effects of sun damage. So if you can start younger and protect the skin of your face, you're going to save yourself a lot of money and delay interventions. But having said that, we can start anywhere with someone. It's never too late to turn back the clock.
That's true.
If you're invested and you're really ready to look more youthful, and we're ready there for you.
You know, talking about the sun, I live on the beach in Daytona, and when I go out on my balcony, I see people still oiling up in the middle of the sun, no hat, no umbrella, nothing. They're just sitting there baking themselves. And there are many older people, of course, around me, and you could start seeing their skin is like leather. It's like
Like
come
leather,
on,
yeah.
people, wake up, stop it. It's
I mean,
amazing.
I have clients say to me all the time, "You don't have a wrinkle on your face.
I know, you
How do
look
do that?"
amazing.
I'm like, listen, it's not because I'm in the chair getting stuff done. You know, I'm not. My staff will tell you, like, it's amazing to get
Yeah.
me to lay still for anything. It really is, in large part, skincare and sun avoidance on the face. And then after that, sure, it's, you know, then it's easy to do a little bit of Botox and a little bit of filler and a little bit of laser. And, you know, it's not so hard. But if you come in with a lot of sun damage, you know, expect that it's going to take a period of time and numerous treatments to undo that.
Yes, and you said something actually that's very important. A lot of people miss that point, is they come in, they have their treatments, and then they go and use garbage on their face instead of having a good regimen that's professionally recommended to them. And I see that over and over. Like, I'll be at the grocery store at Walgreens and somebody's grabbing some of those products, and I'm thinking to myself, what are you doing? Go to a medical spa near you for better quality products. So
Yeah.
I want all the consumers to do that.
I mean, you know, cosmeceuticals is not regulated, and they get to make any claims they want to about anything they want to, and you know, you really can't battle it. You know, it's not going to hurt anybody, but a lot of what's just available in a supermarket or a retail store is what I call glorified moisturizers. You know, that's what it comes down to. There's not anything in there that's going to really promote collagen or reverse the clock. It just isn't. You really, truly, honestly need medical grade, you know, ingredients if you're going to actually stimulate collagen. I mean, I can't tell you the number of people who come in every month here and say to me, well, what about this collagen that I'm drinking that I'm paying $150 a month for? And I'm like, well, I'm sure your colon is really smooth, but it's not helping your face. So, you know, okay, you decide you want to keep drinking the collagen because it's not going to undo the wrinkles. So let's talk about what can undo the wrinkles, right? So what can I say?
It's so funny. It's great. It's so good to be with you. Thank you so much for being with us today. All of you, if you're looking for ways to improve your appearance, we definitely invite you to visit renewmedispa.com and let Dr. Vuich and her team help you chart a great path to a more youthful, more beautiful you, so you can really look your very best, because it is possible now. It's amazing the things that they can do. So thank you so much for being with us today. It was a pleasure.
Thank you for having me.
Do you want to be the next person on Meet the Experts show? If so, go to meettheexperts.com and apply. Until we meet again, be beautiful and be well. Thank you for being with us.